Hi all, welcome back. The last part of the integumentary system, or the skin organ, the last part that I would like to talk about is glands. Okay, and so we talked about accessory organs, hair and nails. We talked about a little bit about skin grafting and things like that. But I really want to talk about glands and then associated systems with the glands. And that'll kind of finish up the integumentary system. And that really will get into components that are kind of important for just general human upkeep of different things, and just in general, when we talk about some uh, ailments and illnesses, part of that, part of the glands of the skin can often fill that role. So there's two real types of sweat glands. You have eccrine or merocrine sweat glands. So eccrine typically indicates that it has a duct that goes from, so the eccrine gland itself is in the dermis, and then it has a duct that goes through the epidermis. Merocrine glands, typically the duct is missing, or maybe there is a duct, but the gland occurs closer to the surface, and so the sweat can just leave via exocytosis, which is, remember when we talked about phagocytosis, how things enter, exocytosis, how things exit. So a little bit different, but nonetheless, this type of sweat gland is very, very, very prevalent in the human skin. Okay, so about 3 to 4 million glands. Okay, and it's dense in places where you would expect: armpits, okay, the palms of your hands, your forehead, soles of your feet. Okay, lots and lots of glands in those regions. So it's a tubular gland. Okay, so there's going to be a gland and then a tube that comes off that gland that deposits a watery, like perspire or perspiration. And the purpose is to mainly cool the body. Okay, so this kind of sweat gland is for evaporative cooling, where you're releasing water, so the water can then, or watery substance can then be evaporated off the surface, and that will cool the body. The myepithelial cell glands are a little bit different. Okay, so it's found in, well, I should back that up a little bit. Myepithelial cells are a different type of cell. It's found in both types of glands. We haven't talked about apocrine glands yet, but eccrine glands and apocrine glands both have the myepithelial cells. And these are cells that can be stimulated by the nervous system, the sympathetic nervous system will cause these cells to contract, and that contraction can cause the gland to squeeze the perspiration out of the duct. Okay, so let's look at some of those myoepithelial cells. Again, they are going to react to nerve impulses, which can cause them to contract and cause the gland to squeeze. And then the material can leave the gland via a duct, or just leave the gland via exocytosis. A lot of times these glands, and we'll talk about sebaceous glands here in a second, but a lot of times these glands will occur in the dermis, but close to the epidermis, and often where these glands are found, you might have a shallower, especially ones that release material via exocytosis, you might have a shallower epidermis in that region. Okay, so apocrine glands Often the best way to decipher between apocrine glands and eccrine glands. Apocrine glands have a lumen or a space that occurs in the gland, and so it looks like an open hole under a microscope. And then eccrine glands are filled with cells or cellular material. Sebaceous glands is another type of gland. This is not a sweat gland, but this produces sebum, or an oil-like substance, and that occurs at the base or along the hair follicle. So all along here you'd see some sebaceous glands. Okay, so again, sebaceous glands produce an oily secretion called sebum or sebum, and this is the material that often occurs like on your face, and you feel like an oily kind of substance on your face or your oily skin. Okay, that, or your scalp feels oily. That's sebaceous glands typically releasing that oily secretion. Okay. They're normally flask in shape. Okay, so the bulb, and then kind of a duct that's coming away from the bulb. And often those ducts will open into hair follicles or near hair follicles. Okay. It's a holocrine secretion style. So the cells kind of just open up and release the material. And then we've kind of talked about this before when we were talking about the structure of hair and whatnot. It keeps the hair from being brittle and drying out, so it provides a fat layer to add to those dead cells. Remember, the hair itself, the parts that you can see, are all dead keratinized cells, and the oil just allows for it to be more moist and not crack and be brittle and scuff off. Okay. Cremulous glands, they're modified apocrine glands, and they're only found in the external ear canal. Okay, and as you can imagine, that's what's creating cerumen or earwax. Again, this is very, very important. Earwax is super important to keep. It has antibacterial properties. It also has a waterproofing property, so to keep out bacteria and water from the inner canal. That's the purpose of the cerumen or the earwax. Again, it's important. It's a fat substance or fat-based kind of substance, as many of the glands that we have in our body are releasing some kind of lipid or fat, and important because a lot of these have a waterproofing property to them. Remember, from, I don't know, maybe middle school, elementary school, fat and water don't mix. And so if you want a waterproofing, then you can lay down kind of a lipid base, and that'll provide that waterproofing. And that's exactly what the cerumen does. And then, like I said, it has antibacterial properties. Okay, so it's nice for that piece. And then it also allows for the guard hairs to trap particles, foreign material, dust. I mean, really anything that can get into the ear canal. It helps it kind of trap it and not allow it to go further down into the auditory canal, which we'll talk about some issues with ears and the auditory canal later. And then the gland that makes us mammals. This is where the term mammal comes from, is the mammary gland. The mammary gland is a milk producing gland, and is found in females of all species of mammals. And so that's really what links all individuals into the mammal kind of grouping, all 4,000 species or so. It's a modified sweat gland. So we know from evolution that the first mammals to produce milk are things like the platypus and the echidna. So those are kind of the first, at least primitive mammals, and they're not the first mammals to produce. They're the mammals that are present on the planet right now that produce milk in kind of a sweat gland like structure. Okay, they don't have a nipple. Okay, so platypus and echidna don't have nipples, and so where the region where they produce milk is more like a gathering of sweat glands on the surface, and so that's one of the pieces of evidence on how kind of mammary glands came about. For the rest of the species of mammals, the duct opens to a nipple. The number of nipples can greatly differ based on number of individuals. For humans, it typically is 2. However, we have, especially females of different species, have what we call milk lines or mammary ridges, in which you can have those glands pop up along those ridges. And so when you have individuals with multiple nipples, humans with multiple nipples, it happens. It's often thought of as being like a mole or like a raised up mole when individuals have it. It's called polythelia, but that's an additional nipple on kind of a milk line. Okay. All right. Let's talk a little bit about skin cancer. And then again, we'll come back and we'll hit some things with each one of these glands. We'll talk about kind of ear infections. We'll talk about mammary gland issues. We'll talk more about skin cancer, but we'll talk about sebaceous gland issues and things like that. Okay, but I really want to kind of talk about cancer in general, and especially kind of talk about skin cancer, because it really kind of ties in the melanophores and the produce of melanin and the UV protection that we get from skin color and things like that, that really ties into cancer. So most skin cancers are the result of UV radiation or UV rays from the sun. Okay, I talked about this a little bit before. When UV penetrates the nucleus, interacts with DNA, it causes what we call thymine dimers. Okay, it can cause other things, but thymine dimers means that thymine binds to itself. Normally thymine, that nitrogenous base, binds to adenine. Okay, but in this case, it'll make thymine bind with itself. Okay, that can cause a mutation, and that mutation then can be passed on. Okay, and then you can have a mutation which causes the cell to just keep replicating itself. And that's really what cancer is, uncontrolled cell growth. Okay, most of the time when we're talking about skin cancer, it occurs in the regions that are not protected or the regions that are exposed to sunlight and UV radiation the most. Okay, so the top of the head, especially in individuals who might be bald, okay, and they don't have protection from hair follicles, they can develop skin cancer. The back of the neck, okay, the hands, the kind of wrist region and the first part of the arm, okay, that's fairly common. And of course, skin cancer happens to be a much higher prevalence in fair-skinned people. Okay, individuals that do not have that melanin um, protection that you would see in darker skinned individuals. It's by far the most common kind of cancer, and if caught early, it's easily treated. It can be, because it is occurring in the epidermis dermis layer, it can be removed, it can be cut out, removed, and survival rate is really high if it's detected and treated early. So 3 types, and it really it's determined kind of where the cells originated and what kind of sarcoma you have. So you have basal cell sarcoma, okay, and remember we talked about the stratum basal layer. You have squamosous cell sarcoma, and then you have a malignant melanoma, okay, and we're going to cover all of these in a little bit, okay. So the basal cell sarcoma, it's the most common type. Okay, it's the least dangerous because it seldomly metastasizes. So that just means it seldomly breaks apart and spreads and keeps growing. Okay, so most of the time it becomes encapsulated, and so that really limits the spread. It forms at the stratum basal layer, okay, the cell layer where we talked about before, where there's a bunch of stem cells. This is where you're getting a lot in the epidermis. This is where you're getting all your cell kind of growing through and going through mitosis and growing, and all those cells that haven't differentiated becoming keratinocytes. This is that region. It will first show up kind of as a small shiny bump with central depressed edges or beaded edges, kind of similar to this. There's some, you can kind of see some beading in here around that region, and that's kind of a little bit of a giveaway that is a sarcoma. Squamous cell sarcoma. Okay, this arises from the spinosum area. So after the cells have already matured and they're starting to produce heavy amounts of keratin, and they're starting to die back in that spinosum. The stratum spinosum is where this arises, and normally this is happening on ears, scalp, the back of the hand, that kind of stuff. It'll be raised, okay, often has a real scaly projection. Sometimes there's going to be a yellowing that occurs, and then later you get a concave ulcer, so it'll be an indentation later when you see that kind of mark. Again, with early detection, removal and good chance to recover fully happens. It tends to metastasize and travel to lymph nodes, and especially in regions like the head, the ear, things like that, lips. It'll travel into the lymph nodes, and then once in the lymph nodes, it tends to spread really quickly to different parts of the body and may become lethal that way. Melanoma looks very different and much more serious when it comes to your ability to survive it. So it arises from melanocytes, so the same cells that are producing melon, okay, can produce and become uncontrolled and produce a melanoma. About 5% of skin cancers, maybe a little less, are melanoma. Okay, if caught early, it can be removed, but if it spreads, Okay, remember these are regions where you're producing melanin. If it spreads, it's usually fatal. Okay. Um, a big risk is family history. So this is why often doctors will talk to you about, what's your family history with cancer? Anybody have melanoma or sarcoma or um, different cancerous, because there is a greater risk um, to some of the mutations that occur. And so even though cancer itself is not inheritable, the checkpoints, the ability to fight off cancer, the ability to check for mutations that occur due to sunlight, UV, creating those thymine dimers, that is genetic. Okay, and so we have a checkpoint called the P53 or protein 53 that goes through and it looks for mutations in your DNA. When it finds one, it removes it. But if your P53 and you have a history of your family have kind of a faulty P53 or it doesn't work very well, then you have a much higher chance of developing a cancer, and a serious cancer or multiple cancers. Okay, um, this is really high incidences in men and individuals who have blonde hair or redheads, and individuals that had severe sunburns as a child. So it's very, very important for sunblock as a child, because later on in life you can develop a melanoma, and it can be very serious. All right, a little bit about burns. Okay, so burns, obviously, there's lots of different ways at which you can be burned. You can be burnt via like just heat, fire, that kind of thing. You can have chemical burns. You can have friction burns, all of which are a little bit different, but they manifest in similar ways because they cause tissue to die. When they cause tissue to die, often fluid will leak into those regions. And so you'll get fluid loss because depending on the type of burn will depend on whether or not you form fluid-filled blisters, which then often rupture and you lose fluid that way. And the other part of it is the eschar, or the dead material, the burnt tissue, can have a toxic effect. Okay, and we'll kind of talk about that in lectures that are coming. Okay, so classification of burns is really determined on the depth of tissue involved. So first degree burns, it's only the epidermis. Okay, so it's that top layer. Really should be able to heal. It should be able to heal without any nerve damage, without any, I mean, you may get scarring, that's still possible, but for the most part, even scarring is often limited to not happening in this region, maybe a little bit here and there. Again, pain, there's going to be some pain associated with it, but you should still have pain in that region after the first degree burn is healed up. A second degree burn, okay, is sometimes called a partial thickness burn. Okay, that means it is all the epidermis and part of the dermis. Okay? And so the part of the dermis, remember the dermis is where you have blood vessels. The dermis is where you have hair follicles, where you have your glands, where they originate. It's also though where you have your nerves, and your nerve endings are right there. And so if the second degree burn damages the nerve in that region and the damages the dermis enough in that region, you can produce heavy scar tissue and lose nerve connection in that region. Okay, so often appears red, tan, or white. It will blister. Again, it's painful and it may leave a scar. It's not all the time that it leaves a scar, but it may leave a scar. This really just depends on what cells are in that region. Can they rebuild the material? Can they rebuild and fill the gap? Or do you have to lay down collagen fibers to fill the gap and it's not filled with actual living cells? And then, of course, third degree burns are the deepest burn, okay, through the epidermis and all of the dermis, okay, even the hypodermis. Okay, so even the fat layer underneath the dermis, and sometimes even the muscle layer underneath that. Often these require skin graft because now you've burnt through all the material that can provide nutrition to that wound. And so all the blood vessels, all the nerves, everything, all the fat that's in that region that would once provide nutrition to that region is gone. And so a skin graft is often needed in order to replace that tissue so you can kind of get supplementing blood flow so you can get new tissue in that region and start that healing process. Of course, third degree burns, very serious. You're going to need to control for infection because now the epidermis layer, that first layer of defense, is completely gone, typically completely damaged, and now you have access straight into the body for infections to get. Okay. So just kind of looking at it from a cross section of skin. Okay, so remember, partial thickness burns typically mean that they're not, they may result in scarring, but they don't go all the way through the skin. Okay, so your first degree might go through the epidermis or into the epidermis and not all the way through. Your second degree is going all the way through the epidermis into the dermis, but not all the way through the dermis, often will result in blisters because a lot of the liquid that's in this region will rise to the surface. Okay, and then full thickness burn or third degree burn will go all the way through the epidermis, dermis, and most of the time into the hypodermis or even through the hypodermis of the individual. Okay. All right, real quick, let's finish up and we'll just talk a little bit about the evolution of skin color. I like to talk about this when we talk about the differences between people and kind of why some individuals have light skin color, some, tan, some dark skin color, and what's the evolutionary selection? What's the evolutionary benefit of having different skin color? Okay, so first off, having skin that is a darker color or has melanin in it allows for ultraviolet radiation to be reflected back. Okay, so it provides protection. So just having dark skin, brown or black skin, would give you basically an SPF of 10 to 15. Okay? And so naturally, and it depends on how dark your skin is, but naturally having a SPF of 10 or 15, okay, so this is, the protection, just like you pick up a bottle of sunblock and you look at it and it says SPF 30, okay, having dark skin gives you an SPF of around 15. If you have light skin, if you're white or lighter in skin, even if if you're an Asian individual and you have light skin, maybe somewhere around 2.5 to 5, depending on the degree of melanin in your skin. Okay, UVR can be damaged, so that ultraviolet radiation can damage, okay, the skin. It damages the DNA. It can also damage the skin itself. Okay? And we talked about first degree burns. You can get a first degree burn very easily from ultraviolet radiation. You can even get a second degree burn from ultraviolet radiation. I suppose it's possible to get a third degree burn, but I think it'd be very, very difficult to do that. But there's a flip side to the coin, right? That ultraviolet radiation, it stimulates vitamin D synthesis. Okay, so vitamin D is really important for strengthening bones, okay, for bone synthesis. Okay, so you have on one hand, you want to allow ultraviolet radiation to penetrate the skin so it can synthesize and stimulate the synthesis of vitamin D. On the other hand, you don't want UV to penetrate the skin because it can cause cancerous cells. It can damage and degrade the skin layers. And so not just a sunburn, but causing skin cells to be damaged and destroyed and die. Okay, so you kind of get this issue of good and bad happening at the same time. Okay? So when we look at the evolution of what's going on, if you evolve in an environment where there's lots of UVR, okay? Maybe you're looking at regions where no matter what the season is, right, there's always good ultraviolet radiation, then you need a higher protection, a higher SPF, because you live in that region. Right? So this is why when we look at places near the equator, okay, most individuals who evolved there have dark skin. Okay? Now the opposite is true. If you live far from the equator, the amount of ultraviolet radiation decreases. Okay? So you now need as much ultraviolet radiation. You don't want to reflect that much ultraviolet radiation. You want to absorb it. And if you absorb it, then you can produce vitamin D, that needed substance for bone health and to stabilize your bone. So we have this at the equator. As you're moving away from the equator, skin tends to get lighter because there's less UV radiation. Okay? When you move closer to the equator, skins become darker to protect from that UV radiation. Okay? And so when we look at kind of a band and it travels in both directions, it just happens to be that in this map here, you can see that Africa, it ends before you can get down into like Antarctica region, things like that. But the skin color tends to get lighter and lighter as you travel south, and lighter and lighter as you travel north. Okay, and this allows for individuals in northern latitudes to have lighter skin and absorb more UV, okay, produce vitamin D, and individuals at the equator who have plenty of UV coming in to protect themselves from thymine dimers. Okay? Next time out, we'll talk more about bones and bone tissues.